But nevertheless, with the oxygen, I just wanted to reinforce that, use it as prescribed, and definitely use the type of device, that would benefit you the most. Any other questions about oxygen? Yes.
Just because my mom, and she's not here, but if you're on the oxygen tank, my mom tends to get a little embarrassed to take the tank with her. She just, I don't really need it. And my sister and I told her, you're taking it anyway. If one of our cars break down, or if something happens and you don't have it, it's like she says, oxygen, breathing's overrated. No, not really. So she jokes about it. She's trying to keep it light. But also, if you have a tank, please make sure that you unkink your tubing. My mom had 8 kinks in her tubing, and she was wearing it at night. And I went into the room and I said, do you think this is working? You're only getting 25% of it anyway. She says, I just pull on it, and it looked like a hose with all the, and I'm like, you're running the oxygen. Now only 2 of you know who my mom is, or maybe 3, but I'm not gonna say it here, but I had to go in there and unkink her tubing. So if you are on oxygen, make sure that you have the open cap of the airway, that you should have kinks in it.
You want to replace your tubing regularly.
Yes.
If you've been sick, you want to discard the tubing and add new tubing as well. Don't let it get that yellowed hard. Like if I'm going to bend it the wrong way, it's going to snap. Really replace it before it gets to that level. And then, if you run out, you need to contact your home care provider. They can also be purchased online. A lot of patients have come to us recently saying that their cannula isn't comfortable. They make all kinds of soft, really silicone feeling cannulas that are so light as a feather, and they're available online as well. So you can change those things up so that you're more comfortable, that you don't get the little sores in the back of the ears and the front of the nose. There's all kinds of great technology out there that will really help you. Any other questions? Yes, sir.
Yeah, it's not totally related, but have anybody found anything to get rid of the dry mouth that goes with this? I can't even the dry mouth.
Biotine. Does anybody use that in here?
Don't really work with me.
Doesn't really work.
Anybody know anything?
Maybe crack spray.
They have a gum, they have a rinse rate.
Yeah, toothpaste with it too.
Yeah.
In fact, I must have 30 of those kits. I'll bring them in.
Please
To the next meeting, and you're welcome to try it. They're all samples, and if you like it, then you can go buy it. It did not work for me.
You said it did work?
It did not. What I do is I wear a chin strap at night. Keep my mouth closed. Dry mouth generally comes from hanging it open.
Yes.
Breathing through it. My dad used to say I look like I found
It's like,
okay? So you use the moisture within the mask?
I don't see it working, but they make them so small now that
Let me ask you this, is your machine above your head?
No.
It's supposed to be above your head. Supposed to be above your head.
The machine should be above my head.
You get that moisture, yeah. Put your moisture, get your moisture kind of play with it till you find out it's right.
I've been on it 10 years, so
Any other
Correction is,
questions? Yes. Okay, sure. If they want to reverse the pulmonary rehab, or yeah, sure.
Or just something else.
Yeah.
And it may sound silly, but I didn't know rain affected my pregnant.
Yeah.
It does. It really does.
For some of our patients, we use the phrase that they have become weather predictors. For some patients, the increase in humidity when it is here, or the increase in temperature makes it very difficult for our patients to breathe comfortably. Flip side of the coin, cold, windy weather will shut patients' airways down. They can walk outside and literally feel like their breath has been, quote unquote, taken away. So yes, weather conditions can affect some. If it does not, that's wonderful. But we like to make our patients aware of the what ifs. So if they know, then they'll know how to handle the situation.
It's gonna sound really silly, like I've been here before, and y'all are just really educating me. But, one of my issues is I'm having exacerbations more frequently. I tend to pick up the germs somehow, and, I've realized I can tell ahead of time, probably about 3 or 4 days before anything's gonna happen. I'll just cough once, and I'll have this plug come on up, and I'll think, oh shoot, something's gonna happen. And sure enough it does, but I can't just go to the doctor and say, I coughed up something, I know something's gonna happen. So, I mean, can a doctor know that far in advance?
He's absolutely right. And then when you're in the office, you might ask him what his or her recommendations would be, because you are seeing a frequency and this occurring. And, is there anything that they would recommend that you do differently? Is there any suggestion on when they want you to be in touch with them as well? But never second guess yourself, because what we will tell all of our patients, you know yourself better than anyone else.
I mean, I won't have any symptoms. They're just, nothing for a few days.
But your red flag is your red flag.
Yeah.
Miss Cat.
Oh, sorry.
Yes, Pumpkin.
When we go into rehab, for anyone that's not been there, we are assessed when we come in and sit down. She does takes your blood pressure and your O2 stat and listens to your lungs and tells you what's going on with you then. So, like she told me today, your lungs aren't moving as well over the time, and it's raining outside. So what they and you feel it, and they hear it, and they're monitoring you the whole time, not only medically, but psychologically. They'll look at you and you're very quiet today, or something like that, and they're very observant. And then all of us that are in there are like a family, and we'll be talking about something, and we help each other when we say something, because the other person may be going through the same thing and doesn't want to bring it up. And we talk about it, and we have the same disease, and find out that it's something that does go on or can go on. So they're very good. They're good.
There is a website called Patients Like Me, and you can put all your information in, and you have respiratory therapists, you have pulmonary doctors that do clinical research studies, and you can put all that information, and they can talk to you about it on any subject that you want. And so it's just like pulmonary. If you have anything that like dry mouth, they can help you with that.
Mine is in regards to dry mouth. My dentist gave me a prescription for the toothpaste to put on after I brush my teeth, because otherwise it causes cavities if you have dry mouth. So that was a good hint. Thank you.
Exactly right. The lack of saliva causes cavities. Well, ladies, I can't begin to thank you. Let me tell you about my plight. I lived in the Jesus country. I didn't tend to visit. I didn't get a chance to pick up 2 little gizmos to give y'all thank you. They may said it before you all, but I drool. Now, listen to this, Christina. There's your little bag. Christmas.
Thank you.
We'll get them tomorrow. I ain't went to get them. And St. Edwards was closed.
Yeah, and there's a woman that does the embroidery
That's so
stuff. and
nice,
so
thank
anyway,
you very much.
School's out today.